happy Saturday. It's Sharing Saturday and today I am going to share with you about fever. How to manage our child's fever. Number one, monitor their temperature. So the temperature for a fever start from 37.5 and 38.5 is considered as high fever. High fever, it can reach until to 40, or the highest fever I've seen before is 41. Means it's very dangerous. The child might get febrile fits. Febrile fits means something like seizure, but it is due to a very high temperature of fever. What can we give during the fever? We can give two types of medication. One is PCM or Panadol. You can give it orally, or suppository means it will go through their rectal. Another type of medication is Voltaren. Voltaren also there's orally and suppository, but usually we would give Panadol rather than Voltaren. And remember, if the child is having dengue, do not give Voltaren. It is not advisable to give Voltaren to dengue patient. Number two, we can do tepid sponging. Means have a wet towel, dip it in a room temperature water, and we can tepid sponge our children. We can put it here or under the armpit, between the groin, or under their knees, or all the places where the heat usually traps, okay? Behind their neck, or even take a shower. If the fever is so high, usually I will just take my son to shower. Just give a warm shower, okay, to cool off their body, but make sure they don't shiver, because when our body shiver, it will increase the temperature very high drastically. So if the child is shivering, stop the shiver first. Okay, cover them with a blanket, make their body relax, and slowly take off the clothes and switch off the aircon. Just use the fan, but a very low power fan, and just to let the heat release the trapped heat around their body. Now I'm going to share with you the symptoms of when should we bring our child to the hospital. Number one is when the fever is more than 3 days. Usually if a fever lasts more than 3 days, doctor would want to do a blood test to check whether is it a dengue, or is it any viruses like influenza, or is there any symptom like hand foot mouth disease, or is it a chicken pox. And when they do a blood test, is it a viral or due to bacterial infection? Okay, from a blood test, doctor can diagnose what is your child is having, inshallah. That's when we realize that our child is very lethargic, means that super duper tired, not as active as before, doesn't want to play ball. During fever, they see ball, they don't want to play with it, just less cheerful, very lethargic, they want to sleep throughout the day. Please take your child to the hospital. Lethargic is one of the terms that your child might fall into any shock. Next one is dehydration. Look out any symptom for dehydration, such as if they have been vomiting. Okay, vomiting more than 3 times a day. Dehydration can lead to hypovolemic shock, which means that they have a very lack of fluid in their body and can cause a shock. Symptoms that shows that they are having dehydration is when they are been vomiting non-stop. Even if it's only 5 times, please just go. They might need IV drip. Okay, if they have been passing out motion for so many times like diarrhea, okay, they need hydration. Sunken or flat soft spot on their head. Usually babies, they have a soft spot here. So if you feel like it's kind of sunken, means they are dehydrated. Sunken eyes, okay, usually the lower part of the eye, you can see that the eyes is some kind of sunken, okay, means they are dehydrated. Dry mouth, okay, usually baby would have a very juicy, chubby mouth, but dehydrated children would usually have a very dry mouth, and you can see the tongue is dry too. When they cry, there's no tears coming out, means they are very dehydrated until they can't even produce a tears. Means they are very dehydrated and their body cannot produce any tears. Vomit and diarrhea can cause dehydration as well. If your child has been vomiting or having diarrhea for more than 3 to 5 times, just go to the hospital. Okay, doctor could put IV drip and to replace back all the fluid and electrolyte that have been passing up from their body. And if your child is having a febrile fit or seizure, just straight away go to the hospital. And during a seizure, what we can observe, and this information could be very useful to doctors, can time the duration of the fit, okay, whether is it 1 minute or 2 minutes, and during the fit, just put them on the side, lateral, on the side, just to put to allow all the secretion or saliva or the vomit to come out. Okay, do not take a spoon or your finger and put it between their mouth. Just let them be. Okay, their body and their muscle will relax by themselves after the episode of the fits are finished. I hope all the sharings are useful and knowledgeable for parents. Please do not take fever. Fever in children can cause so many other problems. Okay? Keep healthy. Teach our children about hand hygiene, about germs, about all the dirty places that they should avoid. From our previous Tricky Thursday, you can teach your child about how does these germs and how can hand washing and hand sanitize can help to protect them from germs. Bye!
If you like this video, click the like button, share it with everyone. Don't forget to subscribe our YouTube channel and follow our Instagram, Facebook, and blog. Bye-bye. Assalamualaikum.